Hello, everybody. My name is Paris. I am a fourth-year medical student at the University of Michigan, and I'm going to be presenting today's health nugget. The topic is mask use in the COVID-19 era. Let's get started. So I think the first question we need to address is, why should I wear a mask? Without going into a long debate on this topic, I think we should just go over a few facts. So the first is that we're at 22 million infections and counting worldwide, and nearly 800,000 deaths have occurred worldwide up to this point. So this really is a very big issue, and while we don't have any definitive solutions yet, one of the things that we do know is that masks do help to reduce the spread of COVID-19. Wearing a mask can help to keep you from both getting COVID-19 and from giving COVID-19 to other people. So this is a really big deal. And I would like you to just consider a couple Bible verses as we move forward, and things that I hope will help to frame this issue of why you should be wearing a mask. So the first verse I want to look at is Galatians 6:2, which says to carry each other's burdens, and in this way you will fulfill the law of Christ. Next, from Acts 20, verse 35, we have a verse that says, "In everything I did, I showed you that by this kind of work we must help the weak, remembering the words the Lord Jesus himself said, 'It is more blessed to give than to receive.'" And finally, from John 13, verse 34, "A new command I give you, love one another. As I have loved you, so you must love one another." And I think the central theme that comes out in all of these verses is that as followers of Christ, we are called to care for those around us. And I think we tend to think of that in a very personal sense. But in this new era where we have an unprecedented health crisis going on, not just in this country, but around the world, wearing a mask and following what guidelines we do know to help keep ourselves and others safe is a way that we can show Christian love for the people around us. So now that we've talked about the why, let's talk about when. When should I be wearing a mask? Well, the Center for Disease Control, or the CDC, recommends wearing a mask in a public setting, when you're going to be around any people who are outside of your household, and finally, when social distance of at least 6 feet is difficult to maintain. So how should you be wearing a mask? The short answer is correctly and consistently, but we'll go over a couple of specifics with this. So the first thing is that before you put on your mask, you should be washing your hands. The idea being that if there are germs that are on your hands and then you're putting your hands on your face, you could be transferring germs to your face. So wash your hands before putting on a mask, and then really try not to touch the mask while you're wearing it. Again, because if the thought is that the mask is keeping virus particles away from your face, if you are then touching that mask and getting those on your hands, it's easier to spread them from place to place. You want to ensure that the mask covers your nose and your mouth. Again, this is for your safety, but also that if you have a virus, you are not spreading it to others through your nose and your mouth. And you do still want to make sure that you can breathe easily. It shouldn't be too tight or too constricting. So this is a graphic that I think really helps to illustrate some of these points. So you do want to choose a mask that has 2 or more layers of washable, breathable fabric. You want it to completely cover both your mouth and your nose, and your mask should fit snugly against the sides of your face and not have any gaps. Things that you want to avoid when choosing a mask are having one that's made of a fabric that makes it very difficult to breathe, things such as vinyl. You want to avoid masks that have exhalation valves or vents, because that can help allow viral particles to escape. And you want to avoid using masks that are intended for healthcare workers, such as N95 masks, as these are still considered kind of a precious commodity. All right, and then a few things I'm sure we've all seen by now, but these are the ways not to wear a mask. So around your neck, it's not going to help you if it's around your neck, around your forehead. If it's under your nose, again, it's not protecting your nose, so we want to make sure that it's covering both your nose and your mouth. Similarly, you want it to not just be on your nose. You don't want it to be on your chin, dangling from one ear, or on your arm. All of these are ineffective ways of wearing a mask. Next, how should I be caring for my mask? So one thing I think people tend to forget is that there is a correct way to put on and remove a mask. We've already talked about how to put one on. In terms of how to take one off, you really want to be careful that you're not touching any of the part of the mask that has been exposed to anyone that you may have been talking to. So you want to untie the string or unhook any ear loops that are present, and then by holding the mask with only the ear loops, you're going to fold it so that the part that was facing away from you is on the inside. And that is just done to keep you from touching too much of that surface. Once you're done with that, you want to go ahead and wash your hands thoroughly with soap and water for at least 20 seconds, or use a hand sanitizer or an equivalent. Once you get to a place that you can wash your masks, you want to do so. You want to clean reusable masks after each use. You can put these in with your regular laundry. You can hand wash them if you'd like. But if you're using a regular laundry, you can use normal laundry detergent, but you want to use the warmest appropriate water for whatever fabric your mask is made of. In terms of drying it, you want to use the highest possible heat setting and make sure that the mask is completely dry before you remove it from the dryer. So that's all the information I have for you today. All of this was pulled directly from the Center for Disease Control and Prevention website, so that's a really great place to go if you want more information about any of these things that we talked about today. And you can also feel free to email me. I'm happy to talk about this or other COVID-19 issues at any time. Thank you very much, and God bless.